Hello everyone and welcome to our summer taster sessions for the Manchester College. We're in quite an interesting building today, but it's the summer house at the end of our garden, just to turn it for today into a first aid studio. So we're going to be doing a session that would appeal to hospitality and catering, travel and tourism and aviation students. Because here we've got Bridget, who is our first aid expert, and she will be walking you through various different techniques and things to do in an emergency, regardless of which course you're on. And of course, you will be learning more of this when you get on your course, but this is just like a little taster to show you the kind of experts we're bringing into the college as part of the Chefs Forum Academy. So Bridget,
hi,
take it away.
Okay. So one of the questions I would ask you all, and those of you who can hear me or don't mind putting it on the chat, have you had any experience with first aid? Have you had to deliver first aid? Have you had to receive first aid? Does anybody would like to say and what it was, and then we can go from there?
Chloe, do you want to start?
Yeah, that's fine. I've had regular first aid training, just part and parcel of being a teacher, working in education for a long time. It's usually an annual event, nothing sort of specific, just general first aid. Luckily, I've never had to administer it or have it administered on me. Don't know how calm I'd be if the situation arose. I think everything would just fall out of my head, sort of thing. But it's definitely good to keep having your top-up sessions and you know, refreshing on all the techniques and things.
Okay, thank you.
Yep.
Chloe, that is a very common thing. So many people, when I'm doing courses, they're really, really worried that it's just going to go out of their head. They're thinking, oh, what will I do? I'll only end up panic if I saw a car accident or somebody being knocked over or somebody collapsed in the shop. What would I do? I know I don't like the sight of blood. And people always worry about that, but I'm going to show you a technique which will hopefully be the key to the door. So the minute you think, oh, fight and flight, will bring you back down and you'll be fine.
Brilliant. So we're going to do like some kind of
Neil.
Well, yeah, Neil.
Yeah, sure,
Yeah.
Sorry, I'm going to ask you.
Yeah.
Yeah, I've similar to Chloe, really. I've been on various training courses. I did one once over about 3 days, so that was quite intensive. I've had first aid administered to myself, and I've also administered first aid to others, but quite basic sort of stuff. Working in kitchens, obviously you get scalds and cuts and a few nasty ones across the years. Some people have ended up in hospital for stitches and things like that. So yeah, but nothing life-threatening. I've never been in a situation. Sorry, there's a
today's session. You there, Neil?
Sorry, that was my wife just taking off to go to shopping.
Okay, right. So you've had a bit of training then over the years, and you're also an educational professional. You teach hospitality and catering, and have done with these taster sessions, you know, throughout the holidays so far, and will continue to do so. You know, just to keep students engaged up until when they enrol next month.
Yep.
So yeah, I mean, in terms of, oh my goodness, we've been invaded by a dog. He jumped through the window.
Come on, darling, you better go. Come on. Right. Just shut the window, please, Alex. Yeah. Sorry, that's hilarious.
I'm quite interested in canine first aid, if we want to pass over to that.
Yeah, she came straight through the window. She opened it's quite hot today, and she really just got back from kennels, so obviously wanted to say hi to Bridget.
Yeah.
Anyway, back to human first aid. So Neil, if you know, what are the most common accidents that might happen in a professional kitchen or in a restaurant environment? I mean, I know that Rosalinda's doing aviation, but there's quite a lot of similarities. You know, front of house and how to deal with customers, you know, in aviation is exactly the same. And so say that we had a guest who was choking, for example, what would we do then, Bridget? What would be the best way to go around? If you've given a guest some food, some in-flight snacks, or if they were in the airport and had a lunch or something and ate something that didn't quite do, what would happen?
Right. So what actually is choking, Kathy? What do you understand by the word choking?
Well, not being able to breathe and spluttering and having something potentially lodged in your throat.
Absolutely. And as you're aware, that I would think as humans we're sometimes a bit badly designed, where our breathing tube, which are here, is right next door to our esophagus, the food tube.
Yeah.
They're right next door to each other.
Yeah.
And choking often happens when people are in a rush, in the elderly and in the young.
Yeah.
So, and so mainly with food. What does, so you said about people coughing and spluttering, but what does true obstructive choking sound like? What do you think that actually would sound like?
Well, actually, I've got somebody with real life experience of this. Neil actually had this happen talking last week. And Neil, what happened when your wife unfortunately choked when you were on holiday?
Yeah, she had some squid or calamari, and then I had, the children were quite young, so I was focusing on them really. And then I looked over and my wife was sort of banging the table because obviously because she was choking, she couldn't talk.
Absolutely. So true choking, severe, is silence. So people think, oh, they're coughing, they're spluttering, they're choking. Yes, that's a mild form, because for me to be able to cough, I won't do it, but I have to take air in.
Yeah.
So therefore, I've got air going in. But it's like Neil said with his wife, she was banging the table, she was trying to get attention. Because true choking is silent.
Yeah.
You can't make that noise. So the first thing I would ask you, sorry, I have to stand up now. Me, yeah, so you're choking. I'm choking. Yeah. So what's the the worldwide sign for choking? What is the human sign for choking? Yes, we all do that. Yeah. And you'd ask somebody, it's pretty obvious, but are you choking? Because you might want your inhaler. Because you might be an inhaler.
Yeah. Yeah.
Then you say, are you choking? The other next question you ask is, can you cough? You only need to ask that once, because you're only going to be, if you are able to cough, you'll only be able to do one because the air would have already been there. So are you able to cough? No. You then do 5 back blows, and you will do those between the shoulder blades. I'm not going to do it on Catherine because it is pure abuse. And I'll tell you now, I'm in trouble. Catherine, I'm going to have to go the other side of you because I'm so right-handed. It's natural for me to do it that way. So Catherine will be in that, actually, you'll be bent over a bit because you're choking. It's that, natural. And you do 5 back blows, and it's quite a strike. You do 5 blows. You can check each time, but to be honest with you, if you've dislodged it or it's come out, she'll be able to breathe and you'll be talking. Okay, you do 5 of those. If that hasn't worked, you then do 5 abdominal thrusts. Some people might know it as the Heimlich maneuver, but we now call them abdominal thrusts. So basically, you go around somebody, make a fist with your hand. I'm right-handed, so my left is dominant, and you're literally just going around. And it's just underneath the diaphragm. And you basically, and I certainly won't be doing that to happen. Inwards and upwards. But the way you're designed, you're already coming inwards and upwards. And if you just feel it on yourself, if you just go underneath your rib cage, if you just push in, that makes you feel a bit queasy. You feel it. It's like being winded. That's what you're doing. You're doing 5 of those. Yeah. And you actually do it with a bit of force. Yeah. And then once you've done those, you go back to the back blows.
Okay. We're doing 5 back blows, and then how many times do we? 5 Heimlich.
5 abdominal thrusts.
Abdominal thrust, right? Yeah. And until when? Then what happens?
And then you do back to 5 back blows.
Yeah. 5,
5, 5, 5. When do you think you'll start thinking about ringing an ambulance? Anybody?
Well,
Alex? Yeah.
Well, I can't ring an ambulance because I'm choking.
You can't choke.
Yeah.
At the beginning. At the beginning. They're choking. You could do. I would normally say after about 3 sessions. So after 1 set would be that and that. So So after about 3 steps, believe me that as time goes on, you will get stronger. Yeah, and tighter. You really go for it because your adrenaline's pumping up.
You really had to do this or something.
Oh yeah,
didn't
yes,
you?
yes. I had this. So I've done it a few times, but I think the most memorable was on my father-in-law on Christmas Day. He had MS and he choked on the sprags. And the reason we realised is I asked him. I said, Jay, do you want some more gravy? I asked him just a very simple question, and there was silence. And then I looked up to think, why haven't you answered the question? And he was there, and I was like, Ogle. They said, Jay's choking, you know, Gramps is choking. And they were, you know, we all went. Because he was in a wheelchair, to get him up, my sons put him up so we could. It was on about the 3rd attempt. So Rupert was my husband who went in first, then his wife, and then I got myself around the table because I was getting the boys to lift him up, you know, just. And I managed to get it out, and asking Jay why I managed to compare to the others, and it's purely because I went in stronger.
Yeah.
So
Don't be shy.
scared. Yeah.
Don't be
So
shy.
that's it. Yeah.
Get in there.
Yes, absolutely. And they always say a good rule of thumb is what you do on your 3rd session or your 3rd round, try and do on your 1st.
Yeah.
So it is a proper strike. It is.
Proper
Proper
thrust. Yeah.
Yeah.
Okay.
Yeah.
Brilliant. So who have we got down here?
Well, what I'll do is I will go through because
Okay,
I
go ahead.
remember Chloe just said that she would always be concerned about what about if I forgot what to do in any situation. So I'm going to teach you. So those of you who've done first aid courses before will have done Doctor's ABC. Doctor's ABC is a training tool which we do throughout all the services. So the fire taught it, the military taught this way, paramedics, police, Coast Guard, yeah, we all go by this. And it brings us straight into that mode of, right, this is what we're doing. Right, so D, Doctors ABC. D, what do you think D stands for? You haven't done a first aid course.
No,
Kathy,
never.
so it's good for you to ask Kathy.
Yeah.
Those of you who've done it, more than likely will have done it this way.
So this is my first experience. I think it's
Okay.
really interesting.
Right.
So
If I give you a scenario then, let's try,
Let's do it.
you come up with another
let's do
scenario.
an aviation one
Okay.
for Rosalinda. Let's do a guest is on a plane
Yeah,
and suddenly complains of heart, like a tight chest. What would you do then?
okay. So you've got, so this is basically all first aid.
Across the board.
Across the board, right, okay. D. My D is for danger.
Danger, right?
Okay. Danger could come in many ways. Or assess the situation is another
Yeah.
way of thinking of it.
Yeah.
Assessing the situation or danger.
Yeah.
Now, you're already in a plane, so you can't stop that, but there shouldn't be, but what about if somebody had put their bag down or something, you're trying to get to your patient or your, what would you call your passenger?
Yeah.
So you're trying to get to a passenger, but you can't because they're stuck in the way, or even if the tray is down, you might want to lift that up, get that out, so you can get to
You've got to secure your area first
Yeah.
of all,
So
and make sure you've got a safe place
Yeah.
to work. Yeah.
Yeah. So if it was somebody who'd fallen over across the road, or somebody in the
Yeah.
kitchen, you might have to move pots and pans, you might have to turn off the gas.
Ovens, that's right.
Danger. Okay, you're
Make
not,
the scenes safe.
yeah, and safe for you. Don't put yourself in danger
No,
as
that's
well.
right. Yeah.
Okay, danger. My R,
Yeah.
what that would be called?
Risk.
Okay,
Response.
thank you. You know that I was going to do some acting then. Is it C or S?
It's fine. It's response. That's fine.
Is it
Fine as you are. Fine as you are.
I was going to put C.
Yeah.
So it's asking for a response. So
Yeah.
the passenger might go, I need help. You
Yeah.
know that means they're alert, they're breathing, they're asking for your assistance.
Yeah.
Great. They might have, okay, I'll go for the kitchen one as well. They might have been Neil's kitchen and have fallen and banged their head. Have you got a response? So Neil might go, Alex, are you all right? Oh, God, you're on the floor. Can you speak to me? Can you answer me? And if you haven't got a response, you know, you've got an unconscious casualty. You're going down the levels here.
Yeah.
Okay.
Right, I won't forget that now. Danger and response. That's my doctor's.
Doctor.
You put a little tiny S just to help you remember it.
Yeah, this here.
It's a non-thing. It just remembers you.
Not really.
You're putting a little one in there, yeah?
Yeah.
Shout.
Shout for help. Most people wouldn't be doing it up here.
Yeah.
If you ever do first aid exams, especially if you ever do military type exams, if you don't shout then, they fail you.
Right.
Even though you shouted all day long.
I was just wondering why it was such a tiny S.
Because it's doctors. It's to remind people to do it there. The likelihood is they've done it up here. I need some assistance.
Yeah.
Alex is lying down in the kitchen. Somebody's buzzing. I need more help here. So you might have done it right earlier on.
Yeah.
But I want you also to make sure if you haven't, you're going to do it here.
Yeah.
Shout for help. Who are you going to call?
You're gonna call an ambulance. Get somebody to call an ambulance.
Which would be difficult if you're in the air.
Yeah.
That's a different protocol altogether, isn't
Make
it?
sure that the pilot knows about the situation, that you've got all the other colleagues on the plane all know about it. They could be asking if there's a doctor on the plane, couldn't
Yes, they could.
Or medical
Paramedic.
So would you do that? Would you say, is there anybody on the
often
plane?
do. If that's their policy and protocol.
And how would you say it?
I'm not even sure how they do it because I've been asked up and they just ask for that. Nowadays, because they know your profession, Rupert and I had when we were in Australia, we were both asked to come up. They just tapped us and said, would you please come to the front? We need to talk to you about something.
Very discreet.
Very discreetly done. And it was quite a difficult situation, but I sat with the woman for the rest of the journey.
Right.
Yeah. So it was, so they discreetly asked. They used to do it as a tannoy and you think, do I go up? Do I go up? But now they know where you're sitting. Brilliant. But like I say, that would be different airlines.
Okay, so the next one we've got today.
Just quickly, just go the numbers. So, what's the international number? Do you know?
What, for the phone?
You know it's 999.
Is it 911 in
That's America.
111? What's the international number? 112. Every day is a school day. I'm learning loads here.
112. 999 and 112 in England are backed onto each other. Your phones are all set at 112.
Yeah.
112 goes to the nearest satellite in whatever country you're in.
Yeah.
So it will find where you are. So 112. But if you just push click to emergency on your phone, or I didn't have a phone and I found your phone, I could easily just click the emergency button. And that's the number it's ringing. But 112 is the number we should all know as well. Okay. Wonderful. Right. I'm going to be going down to Annie in a moment. And what's my A for? If this doesn't work, forget about the rest. We're not going anywhere. Airway. And what's my B for?
Breathing.
Alex, you're showing off now.
She is, isn't she?
Yeah.
Circulation.
I'm not giving anyone else a chance.
No, it's Alex, not me.
Right. Okay, Alex, I'm going to be going down to the floor from now on. Giving Alex out the way and me out the way. Okay. I know Chloe and Neil have done first aid recently-ish. Have you done it since we've been in the pandemic?
No.
No.
No. Things changed at the end of May last year, and with Resus and doing this training, we are governed by the Resus Council. We call it the British Resus Council, but actually it's worldwide. And they changed it at the end of May last year. So in the past, you would have done rescue breaths or breathing for somebody. You would have been trained that way. But we're not doing that now because of COVID, because it would be putting you back into danger. So everything's back to always back to this.
Airway breathing.
Okay, but you can still check that somebody's airway is clear. Now, if I open someone's mouth and I could see, I don't know, piece of broccoli in there, gobstopper, do I think, oh, that there's something in there? Do I put my fingers in someone's mouth and try and get it out? Catherine?
Instinctively, I have done that. I cooked it with my finger with my son before. That's my son. I don't know if I do it. Well, you have to do it to someone who's joking with you.
No, because you know what you're doing for someone to choke you
You put
already.
yourself. Are you gonna? You might push it down further.
Yeah. So if they're lying down, one, gravity is against me. So me putting my finger in is one, I could push it in further.
Right.
Very high risk, gravity against me. Two, what am I putting my fingers in? People have got teeth.
Teeth. Yeah.
Into
deep danger.
danger. I keep going back to danger. Don't put your fingers in someone's mouth.
No.
It's putting your fingers in danger.
Right.
You
Okay.
don't know if they might have a seizure.
And then bite your finger off.
Absolutely. And you're pushing it in further. If you have got somebody who has got something in their mouth and it's not easy. So if it's a mouth guard, because I do rugby first aid, so that's easy to put out. If it's somebody's dentures, they just drop down. That's easy to click out because everything's at the front. If it's further down, or it could be vomit, it could be blood, and you might not be able to. She said, you're going to put your fingers in there and try and put it out. We do a thing called postural drainage. You literally just pull somebody over. You can drain it. In the back if you wanted to. Make sure you've moved your phone.
Yeah.
And when you are phoning for help, put your phone on speakerphone.
Yeah.
Okay, put the phone on speakerphone, so they can hear you, and they will guide you through the rest as well. So help is coming, help is on its way. You say, you know, I've got an unresponsive casualty here, and they'll go, right, you need to check their airway, and then you need to check their breathing. So they'll explain that way through. If there's nothing in the mouth, the other thing which could be blocking the airway is the tongue, and the tongue is slipped back. Hand on the forehead, 2 fingers under the chin, and straight back will now clear that airway. It will drop the tongue down. Okay. Before, we used to train people to look, feel, listen for breathing, and you would put your face right next to somebody else's and look and feel for the breathing. Due to COVID, in our pandemic at the moment, the Research Council have advised us to observe the breathing. Observe for regular breathing. One way I think I could do that is putting my hand on somebody's abdomen, because you can feel somebody taking breath with their abdomen moving, especially in adults. If it's somebody you know and you feel, actually I want this, feels easier, more natural to me, you can do that. But as I said, at the moment we are doing it this way. I don't know when things will change. You check for 10 seconds, but as I said before, you've got to see regular breathing, which means an in-breath and an out-breath. So when you do an in and an out, you have like a pause at the top.
Have we got any questions at the moment, anybody? Is everyone like?
Just listening along, no questions. Rosalinda, have you got any questions? You can just pop them in the chat if you have.
Okay, right. And my C, with, as Alex rightly said, it can be circulation. And it's not that we're checking for pulses with circulation anymore. It's more to check if somebody's bleeding. So if the casualty is breathing, my next check would be circulation.
Yeah.
And that would be with a big bleed. If my casualty is not breathing, I'm going to commence compressions. Like I said, at the moment it's compressions only we're doing. So Neil and Chloe, I realise that you've done lots of first aid courses in the past. We're not doing the rescue breaths anymore. It's just hands on, hands only. So don't worry about counting, just get into a rhythm and keep going. So when we're doing compressions, a good stance is to have one knee where the shoulders are and another knee where the natural waistline is. And even when I look up, my hands naturally go into position. And it's basically you're covering where the heart is. So if you think of your heart being the size of your fist in the middle of your chest, slightly to the left, that's where you're going over. I personally train with one hand over the other. It doesn't matter. It's left over right or right over left, whatever's easy for you. Link your hands, and the weight and strength is going through the palm of your hand. My elbows are locked, my shoulders are in, and you'll hear a do click. And you're doing between 100 and 120 beats per minute, which is most popular music, including that awful Baby Shark one.
Go on, Bridget.
No, I'm not singing that. No, we could do Nelly the Elephant.
Nelly the Elephant. I've also known for my beautiful singing voice. Alex is tittering away in the corner there.
And depth-wise, we're going between 5 and 6 centimetres deep. Okay, any questions, anyone? All okay? Ask any questions?
That's good.
Yeah,
Oh,
okay.
no questions.
No questions,
Are
right?
there any alternative songs than Nelly the Elephant?
There's Staying Alive.
Yeah.
There's the other one, which I don't suggest, is Another One Bites the Dust. Forget
No.
that one. But there's the Archers. Depends how traditional you are.
Let's think about demographics here. Let's think about
Baby Shark.
yeah.
But most, not EDM music, but most popular music, you know, all Queen songs.
Everything you hear on Heart or Kiss FM.
That's the one.
Yeah.
So absolutely. Okay. You keep going. If you can swap over with somebody else, because it's not hard to do, but once you get going, after 2 minutes, it is tiring. If I get Catherine, would you like to have a go? Just show them why not. So you can, yeah, let's get you going so you can see. And after 2 minutes, you would swap over with somebody. And that doesn't mean saying, "Oi, Bridget, come and help me," and I need to be right next to you at the side. So you keep your hands on the chest for as long as possible.
Show me again.
Right. So if you're up in this, I bring in the okay, just because it will be time. Bring one in.
Yeah.
So put your hands in the middle of the chest.
Left or right. I'm left-handed.
Whatever's comfortable for you. Just have a bit that way.
Yeah.
Okay. And down you go.
How many times again?
Just keep going. You need to go deeper. That's it. Brilliant. Go between 5 and 6
Is that all right?
Yeah, you keep going. And that's all you do now.
As many times as I necessary.
Well, yeah, when do you think you'd stop?
I might stop after 10 or 15.
Why?
Just to check if it's had any effect, maybe.
Okay. And if
Well, you're not allowed to do that.
No.
Okay, signs of life.
No. What do you think signs of life could be?
The diaphragm moving up and down, maybe.
But you're moving it up and down.
Yeah, but if I stop, it does it on its own.
No.
Is that good?
No. The proper signs of life will be somebody saying, "Oi, get off my chest."
Yeah.
Opening their eyes, coughing and stuttering.
Get off my chest.
Yeah. Meaning, I want to see proper signs of life. People in the past used to just look for good colour
Yeah.
and sensation and
Yeah.
check the pulses,
Yeah.
but actually you're not doing anyone any favours there.
No.
You emotionally, their colour will change because if you're doing a good job, they're going to have colour go. You're pumping that past the blood around.
Right.
Yes, you're pumping oxygenated blood around. So they will have a better colour.
Okay.
Okay. But you want to see proper signs of life. Also, you'll be swapping over with somebody. Hopefully. And when the ambulance arrives, they will mostly say to you, "Keep going, you're doing a good
Oh,
job."
I can't. There's no blood left in my hands.
It's tiring,
Can you
isn't it?
take over now? Because we're going to be taking turns.
When the ambulance crew arrives, they will say to you, "Keep going, they'll get things ready,"
I
and then
see.
they will.
We just help each other then, basically.
Yeah. So yeah, you just keep going. Adrenaline will help you.
Yes, it will. Yeah, no, that's wonderful.
Okay.
Yeah.
They're coming over
That's
to
your,
you.
that's your chair, yeah.
Okay. The also the if you do have a defib nearby,
Yeah.
the
What is a defib?
do you want me to go through a defib? Yeah, let's go through a defib.
People might not know what a defib is, Bridget. And then where we can find them as well.
Okay. Defibs are much more out in the community than they've ever been, and each year there's more and more available. I can only tell you where they are in my local area, but I expect when you're wandering around Manchester or wherever you live, you'll see defibs up and
So
about.
what do they look like?
Okay, if they're public access defibs, they're usually on the outside of community type buildings or public toilets.
Village hall.
Yes, or social clubs or the local football club.
Yeah.
So they should be in all and malls, you know, shopping malls.
Yeah.
So the biggest one to us, shopping mall, is in Bristol. It's got 5 in Chris Causeway.
Yeah.
So it's got 1 on each level.
Yeah.
And there are
So
signs.
defib is short for defibrillator.
Yeah.
And what does that mean?
So the proper name is AED.
Yeah.
So it's automated external defibrillator.
Yeah.
Okay. I'll show you one here in a moment.
Mm-hmm.
I've got a training one here. The ambulance, when you're phoning your 112, you're speaking to ambulance control, they will let you know where the nearest AED is to you. If it's a long way away, they're not going to tell you about it. It's got to be within running distance. Somebody still needs to be doing CPR, pulmonary resuscitation, while somebody else runs to get the
Sorry,
DP.
CPR. What does that mean?
Cardiopulmonary resuscitation.
Cardiopulmonary
Cardio.
resuscitation.
Yeah,
Long word for a Monday morning.
I know, so I said CPR.
Yeah. I've always wondered what it meant.
Cardio means heart, pulmonary
Is breathing.
breathing, lungs, yeah.
Oh, lungs.
Yeah.
Oh, well. Yeah, lungs.
And resuscitation
It's obviously when
you're
doing well, just doing
Yeah,
the.
that's absolutely.
Yeah.
Okay. So somebody should be doing CPR.
Yeah.
A defib turns up. They are, the public access ones are for just general use. They are very easy to use. They will all have an on, up a bit, down a bit, down a bit. Okay, here. They will all have an on-off button. They will all have a shock button. Some will have an information button. A lot of them now will have the information button. Right, let's hope my machine plays ball. I'm going to turn it on and I'm just going to do what it says. I'm not going to speak over this. I'm just going to go with it so you get to hear it.
Yeah.
Okay.
Remove clothes from patient's chest. When patient's chest is bare, open grey plastic case and peel off white adhesive pads. Look carefully at the pictures on the white
Oh, hang on.
straight press pads firmly to patient's bare skin.
I'm just following the picture
Be
instructions.
sure the pad's connector is completely inserted. Make sure that both pads are removed from the case.
I've done that.
Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advice. Stay clear of
Please
patient.
do that.
Press the flashing orange button now. Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters. Keep time with the beat.
This machine is set at the old rate for 30. I'm just going to stop so you can hear what happens next. Because it's also now the same thing. So we'll do-
Pinch nose, tilt head, lift chin, and give 2 full breaths. Breathe,
It's slightly creepy.
breathe. Continue with compressions.
I'm going to stop it there a moment. Right. Like I said, all the AEDs are still set from what we used to be able to do, 30 to 2, 30 to 2. But like I said, things changed a year ago and you would ignore the breath bit, you just carry on with your compressions. Like I said, we don't know when things will change back. Yes, Alex.
When you put the pads on,
Yeah.
and the electric shock goes in, does the patient normally then jump?
Jump.
Because
Yeah.
obviously nothing happened then.
No, because yes, it's
Yeah.
training. So the ones you see on Casualty and or the City or whatever programs you might watch, they're all manual ones. The ones you're looking at, hospital ones. So you can set how many joules you set it at. These are set at 200 because they're automated. You can't change anything. Does the person slightly, not as dramatic as you see on the television. That helps that the chest would rise a little bit, but you might not actually notice that. But like I said, the one that you would have seen acting, this would have been the same type machine which would have been used on Ericsson, the footballer who went down. Yeah. And this is what brought him back like that, but this is what they would put on. And you can see his body moves a little bit, but it's mainly moving because people are doing that. And then they stand clear on and you can train that. So it's a defibrillator. So what it means is when the heart is fibrillating, in medical terms we call it VF, ventricular fibrillation, this converts it back into your PQRT, which is your finest rhythm, is what we're all in now. So the heart works in rhythms. So this is defibrillating, it's changing it back into normal rhythm. Okay, that sounds a bit highfalutin.
Well, if we wanted to do more first aid, we could, couldn't we?
Yes.
If this is interesting, this is only a taste of it. It's a lot
Absolutely,
to
and
cover.
yeah,
And you know, we've got a quarter of an hour.
yeah. Let's do other things now. Any questions on that? No questions. No questions.
Not the chat.
Okay.
So I've just got one question then. So
Yeah.
you're not allowed to breathe air into the casualty's mouth anymore.
Yeah, at the moment.
Yeah, and I understand that's because of COVID and what's happened, but isn't, when it comes to sort of life and death, is that the maximum that you can do now then? So that must take an element of that treatment away.
I know. So, I mean, it's me training you to say it's back to your doctor's ABC. It's back down to danger, and that kind of thing. A lot of my students ask, actually, if this was my family member or somebody I knew or something else, would I be? And I go, that's fine. It's your risk, if you see what I mean. So you're assessing the risk. If you feel like, actually, I live with this person, I know this person, I want to do mouth, you go for it. But it's purely the resusc council is saying, if you don't know somebody or you're concerned about COVID, then don't do mouth to mouth. Does that answer your question, Neil?
Yeah, that's fine. That makes sense.
I think it's a person. It's back down to D. It's a personal risk.
Yeah.
Okay. Right. I'll just put Annie away. Should we do recovery position? Yes. Okay. Right. So I know Catherine sadly hurt her back this weekend, but I have no mercy.
No, I didn't assess my pee properly.
No,
and,
she didn't.
I was getting out of one boat and into another, and I slipped on a wet floor of the other boat.
I'll go back
And hurt my back on the engine. So that was not to be advised.
Okay. I'm going to have my back to the camera on this bit. Okay. So I'm going to roll you that way purely because of your
Injury.
Yeah. So if you lie down
On my back.
yeah. So
Meanie. Okay. Okay.
Okay. All right. So I'm just going to put down. All right. So always do your doctor's ABC. I mean, the dogs have gone, so I'm not in any danger anymore. Catherine,
Danger been licked, more like.
Catherine, you all right?
Well, my back hurts a bit, but yeah.
Okay.
Right.
Well, the thing is now, Catherine, she's lying down doing her yoga. She's fine. She's talking to me. She's breathing. I'm not really worried. Okay. But this time, maybe don't respond to me. Okay. But maybe squeeze my hand if I talk to you if you get pinched. Okay? Hello, Catherine. What are you doing on the floor? Did you bump your head? What's happened here? Catherine. Right. Catherine stops. Catherine, can you squeeze my hand? Come on, Catherine. Open your eyes. Come on. Come on, Catherine. No, I know she can hear me. She's squeezing my hand. Yeah, she can hear me. Right, I'm going to have to go to get to the phone because I haven't got my phone in my pocket. I'm at work. I'm in the kitchen. Got my bag's just there, but I need to leave Catherine. And my concern is Catherine's conscious level might not be able to maintain her own airway. So I'm going to put her into the recovery position. Right. So the first thing to do is you're going back. Yeah, I'll turn you towards the. That's what I did it. So, yeah, sorry, she's more worried about which way I turn her.
The best side.
Yeah, the best side. I will also do a head to toe check, but because I need to go quickly, just going to divert your
You
breathing.
took my glasses off. Why was that?
Because of it, I'm going to put them in your hand so I don't. Right, just take your glasses off. Yeah, I'm just. I don't know if you can see me do this. I'm moving the hand furthest away from me and putting onto the side of her chin. She's already lifted one knee up already. Do you want to lie that one down? Both of them. Both of them. All right. So the leg furthest away from me, the knee furthest away. So the two limbs, the arm and the knee furthest away from me, I've moved. I now leave her with the knee, not pulling her arm out of the socket. I leave her with the knee over the side. Go straight back to checking the airway, which is tilting that head back. And now I'm going to. You've got to be relaxed. Sorry, you're unconscious. Behave yourself. Okay. Right. Now I'm going to get that phone. Right. Or I might be making that phone call, but I've got a few people down. They've all been having too much to eat and drink in Neil's kitchen, and I now need to have a few people on their side in case they vomit. So, Catherine, you can go back now, my love. Right, thank you.
Okay, good.
Yeah. Okay. So the reason you're putting somebody in the recovery position is to. Sorry, do you want me to step up? The reason you're putting somebody in the recovery position is to maintain their own airway. Any questions on that one?
No, I'm fine with that. That's
No.
great.
Okay, anybody on the chat? No?
You still following along okay, Rosalinda? Let us know on the chat.
Yeah. Oh, she said there's no question.
No, she won't.
No. Oh yeah, everything's okay. Lovely. Brilliant. Okay. I'll come back over here then. Make a little bit more space.
So that was the recovery position. So what we did was the danger response, airway breathing.
Circulation.
Yeah. So the danger was.
Do you want to go through any scenarios or anybody would like to come up with a scenario in a day-to-day life thing? So I've just given you two basics of what to do. I've got one, we got one from the floor. Electric shock. Electric shock. Right then, Alex, give me the scenario and let's see what you're going to do knowing this so far.
Scenario. Okay,
Right.
so you're on a long haul flight,
Yeah.
first class.
Yeah.
Um,
This makes it a bit harder for me. Remember, I'm not aviation. So okay.
and
Yeah.
someone's been in the shower.
Yeah.
And they're really wet.
Yeah.
But they've come out and they've got their private bathroom.
Yeah.
and
Yeah.
Yeah.
they're plugging their head onto the ball and something malfunctions with the
Yeah.
socket and they get it from shock.
Okay. So
Then when they're wet.
right, okay. So you always go back to a doctor's ABC, and this is when Chloe said about, oh, I wouldn't know what to do when if. Think doctor's ABC every time. D, danger. My danger is the electricity still alive? I don't personally know how airlines work, and if there is an electricity problem, does it switch itself off? I don't know. I do know on land that a lot of houses would have a trip switch. So if somebody's putting maybe a drill into the wall and they hit a socket or the toaster or something else, it trips out. If it hasn't, you're turning the electricity off. You've got to make sure the danger. Then you can now go and check. So once it's then safe, you then can help your casualty. Yeah, so make sure it's safe for you and then. Yeah. So it's, can you hear me? Are you all right? You're back to response. Have they been shouting, believe me, they've got an airway for their breathing. If they're quiet, you're going back to this. Take it that they're breathing. With electricity shock, you will have so it is back down to, one, it's a shock, two, it's a burn. And you will go back to the entry, so with electricity, so say it's like a drill, or you're saying the person was doing the hairdryer, so it's on their hand still, but that electricity will go to the nearest earth point. So it could be their hand, if they've got their hand on a, or it could be their feet, or maybe she's leaning, and he's leaning against something. So the shock will go through and exit the body to the next nearest touching point to earth. You see what I'm saying? So you've got two burns to look at as well. So
Anyway, you get burnt.
Yeah.
I just we were talking about burns, you know, because these sessions are going to be for, you know, students on hospitality and catering courses as well.
Yeah.
I saw some very nasty burns over the weekend. You know, they're normally on arms, aren't they, in the kitchen? So if I had a nasty burn with some hot fat on my arm, you know, I've been asked to go and cook some chicken Kiev.
Yeah. And
you know, one might have sort of splashed some oil on my arm. What would I do? What would be the quickest response?
Okay, so and in kitchens, so scalds and burns in kitchens must be, and I'm sure you all that knowledge, maybe one of the highest, you know, first aid things that happen. And my son's also working in kitchens at the moment, and his arm's covered in burns. So what you do have in kitchens is running water, which is brilliant. So please go straight to the running tap water and put your hand, arm under there. If possible, and I do appreciate it's difficult, but the first aid time should be for 10 minutes.
10 minutes?
Yeah. 10
Why
minutes.
is that? Why so long?
But it actually cools it down, so it will also stop it going down the layers of skin. It's got 3 layers of skin, and it'll stop it going down. So if the longer you have it on, the less likely you'll have a scar and it blistering.
Right.
Okay. So minimum 10 minutes, and I do appreciate that it's difficult.
Then after that 15 minutes, then, you know, I have seen in some kitchens they have got this burn spray. Do you agree with that?
This is when I say to people, what you do to yourself and yours and your own. So if you saw the burn spray there and you want to use that burn spray, that is up to you. But if you're assisting or helping somebody else, and maybe they are unable to make that decision, then it's best not to, because you might not know if they have an allergy to that. The other problems with creams and sprays, if it is a 3rd-degree burn and it might need plastic surgery, grafting, all that has to be scrubbed off. And I have been that nurse to scrub creams off before people go to theatre, which is not nice. So if it is a severe burn, you're still better off just doing the water. And if it's going to the hospital, just the water. Do not be tempted to put sprays or creams on. There's a terminology in first aid called no lotions, no potions. What you can do to when you're travelling to the hospital or to cover the burn, and again it's something you wouldn't really have in kitchens, is cling film. Now cling film, what also makes a burn quite sore is the air to it. Covering it with cling film will also protect it, and it will make it hurt less because you're covering it. And I don't mean cover it with like you're doing your turkey or you're covering like the sandwiches, wrapping round and round. Take a layer off and place it on, because if you're having swelling and you're wrapping it around, you're only going to constrict. So you're better off put it on as layers. Okay. And how would you then secure it? You could just do a tape, but if you are, it's quite severe burn and you don't have the light, you just lift hospital, so you just put it on as a covering. Especially with a lot of burns can be blister quite badly. So you're catching the fluid from the blister as well that way. But you can just put a bit of micropore tape, which is like paper tape. Would you have that in your first aid kit? Because you've got your first aid kit here today. And what we just like maybe cover what's in your first aid kit. So you should be first aid. This is going on. Right. So there's always gloves, which I know in kitchen solution. We've got loads of those these days. In my first aid kit, I've also got some shears. remember when I was doing the defib, it said remove clothing. These are much cheaper now, and they're like scissors, but they cut clothes, and because they've got a flat edge, they don't cut the skin, so they are classed as shears. Microphone tape. So I'm just going to, can I put that on your lap?
Yeah.
So I can. So microphone tape. This is like a hypoallergic tape. It's not, you see, the problem with Elastoplast, a lot of people are allergic to the glue on the red plastic.
Yeah.
But microphone tape is made of paper. You don't need scissors, you can just cut quite easily. Yeah. So I would certainly suggest having microphone tape in the first aid kit. Also, you can write on it.
Yes. So we've got a triangular bandage. Now what's that for?
If you, so you might be using a triangle bandage if somebody's got a nasty cut. And I know Neil was saying in the kitchens that you can have quite nasty cuts, so people might need suturing, which is like stitching. But as a first aider, you're not going to be doing that yourself, but you will need to put pressure on a bleed, and elevate. And you might use this triangular bandage to elevate the arm, or it might be there as a comfort if you've got somebody maybe with dislocation of the shoulder or a clavicle, or sprain, so they find that is a comfortable position. Okay. So yeah, I can, if we've got time, I'll show you how to do. We're not using that one so much nowadays.
About breathing.
Yeah. They're just some wipes. Again, you're in a kitchen, you might have wipes, but to be honest with you, water is better than
If you're out in the field or anything, they're just going to.
if you can have water, I think water is better. They're just
sauces.
Yeah.
Yeah.
Sauce. The other one is very good is NA, non-adherent dressing. This one, I think these are very good. Let's just pass them a scissors. Non-adherent dressing. Remember I said that some people are allergic to plasters. An NA, non-adherent, melatonin or relief of the makes of them. They have a shiny side. This one does have both shiny sides, but the shiny side goes to the wound. If you've got a burn again, you might put that on and put the tape. But you can also, with speed, or if it's say, a small blister or a smaller cut, you can always cut inside the package. And then you've got your keeping it clean. This is easier. That's just an information leaflet.
Or we can do one of these and give it to Chloe to send on to the students as well.
Yeah, I can.
We've got all the different steps here that we will put into a PDF, and so we can email it to you. So that goes to Rosalinda as well. You know, we'll make sure you've got a little record, so don't worry about having to write everything down.
Yeah, that's great.
Is there anything else? So basically, first aid kits. In the past, the HSC, the Health and Safety Executive, were quite strict about what was kept in first aid kits. Thankfully, they're now allowing you to use your own common sense. So in the kitchens, you might have, so you've got your microphone, you might have a lot of NAs, things for cuts. In, I'm trying to say aviation, they'll have their own first aid kit, but you can now tailor make first aid kits for your usage. So say in the kitchens, you might have a lot more bandages for cuts and what have you. And Neil, a tip I would use is the medium dressing is quite a, it's usually the most one you'll use, which is the wound dressing. When you take them out of the packet, if you've got a a classic, I call it the avocado hand cut, where somebody puts the avocado in their hand and straight down with the knife, and they go straight through, and then you've got a nice cut in the hand going across. Instead of opening all these ones up or grabbing all the tea towels, if you grab them those, if you put that across the cut and squeeze the hand, so now I've put pressure and I've elevated it. When I'm doing a lot of my rugby things, a lot of the time I don't release it. I use these as my pressure because I've got the cut that way instead of doing that. Hold it and move the bandage around and hold again. So with this, you can actually use this more as your force to hold it instead of opening it up. A lot of people feel that they've got to open it up every time. You don't need to.
Mm.
You can keep it shut and use that as your pressure.
Makes sense. Good tip.
It's a good tip. It's something I've been doing it a while now. It's just, for me, I just think it makes perfect sense to,
Yeah.
So they cut there, right, let's get that on, keep that there, hold the pressure, and we'll now open up another one just to hold it on. And it means they're doing something as well. While you quickly give that to them, you can put a fresh pair of gloves on and get the area sorted. And if somebody has cut their arm quite badly, and again, I'm thinking more the kitchen, or maybe with aviation or with front of house, somebody might have fallen or slipped or drink out of a glass and
glass
smashes. Especially in this heat, glasses do smash more.
Yeah, we were saying the other day about you were telling me about a child once got hold of a champagne glass when mummy wasn't looking.
Yeah,
and mummy might have had a couple too many. And so then the child took the glass and pushed it into her face, and then the child had awful. Goodness me.
Right, it's just the fan falling over. It's right. We've still got Alex with us, who's now climbing out the window.
She's shutting the window to stop more four-legged things jumping through windows.
If just a question, if you have got somebody with like a glass injury and the glass is still visible, or you're not sure if the glass is in there, do you, if you say you did see that, would you remove the glass or not? Would you, or a knife even?
No, because you might actually cause an even bigger bleed.
Yeah. So leave it there. What you can do is
Take them to hospital with a bit of glass protruding.
yeah, and you can use again. You've got your two badges. If it is glass, you can go either side and just to practice it, to pad it really. When somebody does have glass, it doesn't bleed as much when there's glass in there. It's more of a trickle. It's only once it's taken out it really bleeds.
And that can panic people as well, can't it? Yeah. I've learned a lot today, Bridget. I have. My son had busted a glass recently, and he had a great big stitch hanging out of his head. And Dad's sort of reaction was to remove it. And then when he did, it was like, the blood started trickling down. It was awful to see. It looked awful. So I've learned a lot today. It's very, very
And scalds, just to say, especially when you're hot and warm, you bleed more. Especially I think maybe in kitchens you're going to bleed more because it's hot and you're racing around. And heads really do bleed. Scalds and heads are, and usually they have the tiniest of nick, but it looks like you've got a massive hole.
Why is that?
Because it's well supplied. Well supplied by the blood system.
Yeah.
I mean, anywhere which is well supplied, which is face and head, the most of our brain, bleed.
Yeah.
But they also heal very quickly.
Yeah.
Neil, I've heard of one.
No, it's just listening. It's great stuff. I've learned a lot as well today.
Brilliant. And Alex always knew what DRABC, doctor's ABC. She was listening when she did
I student Edinburgh a long time ago.
It's working.
Yeah.
Once it's in, so that really, as I say, a lot of people do have that. Oh my goodness, you've just seen a car accident, or someone's just been knocked over in the road, or somebody slipped and fallen in the co-op, or something happened in the kitchen. And
supermarkets are available.
Sorry, that's the nearest one to here. Sorry, Asda, Waitrose, Tesco, Sainsbury's, Aldi, Lidl. Is there any others? Morrison. Oh yeah,
Netto up north.
Netto. Just I was thinking the nearest one to here. That's what I was thinking in my head. That's ones that I always seem to see little old ladies falling though. That's what happens locally. But yeah, if you just have somebody and you're going, oh my goodness, what do I do? Try and remember, take a breath in, out, doctor's ABC, danger. Am I or are they in any danger? And off you go. Can you hear me? Are you all right? What's your name? They're talking to me. We've got airway, we've got breathing. Happy days. Yeah. And then you go through. Is there any other thing wrong there? Have you hurt yourself in any way? Would you like me to get you some help?
Yeah. Very good. Well, I think that's all we've got time for today, Bridget. Like I say, we will get this all designed up for Chloe to be able to give to the students.
Thank you, Bridget.
Okay.
If there's any other questions, you know, that Rosalinda wants to ask afterwards, you know, that she didn't get time to ask today. I mean, thank you for joining us.
Yeah,
It's
thank you,
great to have
Rosalinda.
you on. And you know, we just want to keep you informed as to what we're doing over the holiday. You know, there will be more courses like this. Do have a look at the course breakdown in terms of our little tasting sessions that we're doing for hospitality, catering, travel, tourism, and aviation. And you know, just keep talking to us through the holiday, and we'll look forward to seeing you for enrolment next month. So in the meantime, if you've got any questions, do by all means email Chloe and we'll get them answered by our experts for you. But in the meantime, have a wonderful summer and we'll see you again soon. Thanks ever so much.
Thank you. Bye-bye.
Thank you.